Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com and check out the blog tab on our website. I've got about 100 articles up there so far. And also check out our new online dry needling courses. We have one, dry needling in the autonomic nervous system, and then we got another one coming up on pelvic floor, and we're going to have a whole course series by the end of the year. Okay, so a question I get asked a lot about during class and after class is specific parameters and how to use the electrical dry needling units. Okay, so for the electrical dry needling units, these are the two units that I have. You can get them on lhasaoms.com. That's my favorite website to get dry needling stuff. So it's lhasaoms.com, and we have a discount code, Intricate15. We'll give you a discount on these. So this machine is called the AXUS ES-5. So I really like this machine. This is my new one. Okay, so this is my old one. I'm missing a knob on it now. This is the AWQ 104L digital electroacupunctoscope. That's a pretty cool name. Okay, so there's a couple differences between these two machines. Let me go over my old one first. So on this machine, there's numerous different things you can get. So there's 4 channels, so you can hook up 8 needles to the stem, which I like. I always want to have more channels. I would love to have an 8-channel machine. On this machine, as far as the buttons that I typically use with my needles, this knob changes the hertz for all 4 channels, right? This knob here will put it through a distribution, so if you turn this one up, you'll see it, whatever you start the hertz on, it'll go from that. So say you have it on 1 and you turn this knob up, it'll go through like a pulsing distribution from 1 to 47 or whatever back down to 1. I just like to leave it on low frequency stimulation. So remember, 1 to 5 hertz has been shown across the electrical literature to be the best at releasing endogenous opioids from the hypothalamus, like beta endorphin, right? That helps control our hypothalamic pituitary adrenal axis. It helps control our gut-brain axis, and it helps control the trigeminal cervical complex, which are all closely related and interlinked as far as the autonomic nervous system goes, right? So, okay, so again, the far right button on this one's on and off. You can change it, the frequency higher or lower, and then times it 10 times 1. Again, I like to use 1 hertz because I think it's the most homeostatic, because it's the closest to typical heartbeat, right? So whenever you get the hertz set on this one, when these click, it's on. So the major difference between electrical dry needling and electricity using the pads is it goes from very comfortable to very uncomfortable super fast. So on both of these machines, typically around 3 is where people feel it, and I just want the people to be able to feel it. I'll get to that in a second. Last thing about this machine, these black buttons up here, you can change the polarity, so that just basically makes the electrons go in a different direction, clockwise or counterclockwise through the current. So typically, the electrons are coming out of the negative lead, the black lead, and they're going towards the positive lead, the red lead, which is putting cations or positive ions into the body. So remember that. Electrons are coming out of the black lead, positive ions are coming out of the red lead to pull the electrons over and to complete the circuit, right? This machine I really like. So it's a bigger machine. It has the same amount of channels. It has 4 channels. But you can change the pulse width on this machine. So if you think about the pulse width, think about the thickness of a wave. The thicker and wider the wave, the higher or the larger the pulse width. The higher the pulse width typically stimulates sympathetics more and the patients feel it more. So I typically keep these 2 knobs down on towards the bottom, because I want the pulse width to be as minimal as possible, because my overall goal of treating physical therapy patients, or really any patients, is to push their nervous system towards neutral as much as I can. So that means depressing sympathetics, depressing pain, and elevating parasympathetics. So again, low frequency, 1 to 5 hertz of stim has been shown across different medical literature to be the best at long-term pain relief and depressing sympathetics. So this machine is really nice. So one thing that you can definitely do by accident is if you turn on the juice and the person's hooked up to the stim and you don't have a safety, you can really blast somebody with the needles because it's a lot of stuff, current going through just a little piece of metal. So if I turn on the intensity or on one of these channels and I try to turn on this machine, the alarm goes off, which is awesome. So then if you turn them all off, it'll go on. So this machine has a safety. It won't let you blast people. On this machine, the two blue knobs right here, that's the frequency for channel 1 and 2. So that's the hertz for channel 1 and 2. This is the hertz for channel 3 and 4. And then these are the intensities per channel. So you just line them up per channel. Just like on that machine, somewhere around 3, I want people can typically feel it, and I just want them to be able to feel it, right? This one also has a 15 and a 30-minute timer. It's got 3 preset settings, a continuous, a modulate, and a burst. I usually just leave it on continuous, right? So the things that I really like about this machine is it has a timer, 15 and 30-minute timer, and it has a safety where you can't blast people. So as far as the other differences between microcurrent and regular stim goes, is that when you're using electricity with the needles, you really need to use a micro or a millicurrent. So microcurrent is 0.05 amps, millicurrent is typically 0.005 amps, and then regular stim machines are 1+ amps. So if you use regular stim, it's too much juice, it's too many amps going through a little piece of metal and it hurts. A lot of the new E-stim ultrasound combo machines do have a microcurrent setting on them, and Loss of Ohms does sell some adapters for needles that you can hook up to those. Okay, so last thing about electricity, which I think is just one of the many common things in medicine where people have just been told this is the correct way to do it forever, but it makes no sense neurophysiologically. So unless I'm trying to help somebody recover from an atrophy or a weakness or something like that, if their muscles are not atrophied, having the muscles contract is actually detrimental to what you want to do with the nervous system. So the overall goal of treatment should always be to depress sympathetics as much as we can, elevate parasympathetics as much as we can, and induce autonomic nervous system homeostasis to the highest level possible to allow the human mind and the body to start to self-regulate themselves. Muscle contraction is a sympathetic activity. Muscle relaxation is a parasympathetic activity in general. So most people are taught to use stim to make the muscles start jumping around, and they say, tell the patient to tolerate strong but comfortable. This is turning on the part of the nervous system that is already the problem, the sympathetics. The only reason that it does work temporarily is you tire the muscles out to the point where they actually relax. A much better way to go about it, in my opinion, is to just have the patient feel it. You're not going to be able to avoid muscle contractions, especially if you're near trigger points or motor points. But I just want the patient to be able to feel it, and I want to limit the amount of muscle contraction because my overall goal is to maximize parasympathetic dominance compared to sympathetic dominance. The last thing about thinking about electricity. Regular healthy muscle cells live at about -35 millivolts. When the sympathetics become chronically hyperactive, our cells get more negative, and the threshold that they need to cross to fire becomes smaller. So healthy skeletal muscle cells live at -35 millivolts. To fire, they need to get to about -70 millivolts. In chronic sympathetic hyperactive conditions, maybe our muscle skeletal cells are living at -40 or 45 millivolts, and to fire, maybe they only need to get to -60 or 65. So the electric potential that they have to cross to cause muscle contraction is less, and it makes it easier for the muscles to contract. That's why people with muscle spasms and hypoxia and neuropathies and stuff always have sympathetic hyperactivity, because that's what fouls up the muscles. So when you're needling, the patient, if you pay attention and you turn it up slowly, will almost always feel the stim on the negative lead first, and then if you turn it up enough, they'll feel it on the positive lead. But again, if they can feel it on one lead, the circuit's connected. That's just how electricity works. So I just want them to be able to feel it. So if you think pain, positive, PP, right? You always want to put the positive lead over the most painful tissues, because the positive lead puts cations or positive ions into the body, which attract the negative electrons over. That makes the tissues more positive and makes them less likely to fire. And making the tissues more positive is what they need to become more homeostatic, right? So it's helpful under both leads, but if you have people that are really hypersensitive in a certain area, put the red or the positive leads in that area, and you will see their pain depressed very, very quickly. It makes the treatment more comfortable, and I really think adding electricity probably increases the overall efficacy of treatment by about 15 to 20% because of the amplification of autonomic nervous system homeostasis you get. Right? So I use stim with 100% of my patients. I really think it's good to try to connect the different parasympathetic areas to each other, as well as treating whatever else you're going to in the body. Thanks, guys. Let me know if you have any questions about anything.